Another day, another story. 1. A patient with anorexia nervosa is a member of pre-discharge support group. The patient verbalizes an interest in buying new clothes, but expenses that money is limited. Group member have brought some used clothes to the patient to replace the patient's old clothes. The patient believes that the new clothes are much too tight and has reduced personal caloric intake to 800 calories daily. How would the nurse evaluate this behavior? A. Normal behavior. B. Evidence of the patient's disturbed body image. C. Regression as the patient is moving toward the community. D. Indicative of the patient's ambivalence about hospital discharge. Answer: B. Rationale: disturbed body image is a concern with the patient with anorexia nervosa. Although the patient may struggle with ambivalence and showed regressed behavior, the patient's coping pattern relates to the basic issue of body image. The nurse should address this need in the support group. 2. The spouse of a patient admitted to mental health unit for alcohol withdrawal says to the nurse, "I need to get out of this bad situation." Which is the most helpful response by the nurse? A. Why don't tell your spouse about this? B. What do you find difficult about this situation? C. This is not the best time to make decision. D. I agree with you, you should get out of this situation. Answer: B. Rationale: the most helpful response is one that encourages the patient to solve problems. Giving advice implies that the nurse knows what is best and can foster dependency. The nurse would not agree with the patient, and the nurse would not request that the patient provide explanations. 3. The nurse is assessing a patient who was admitted 24 hours ago for fractured humerus. Which findings would alert the nurse to the potential for alcohol withdrawal delirium? A. Hypotension, ataxia, hunger. B. Stupor, lethargy, muscular rigidity. C. Hypotension, forced hand tremors, lethargy. D. Hypertension, change in level of consciousness, hallucinations. Answer: D. Rationale: symptoms associated with alcohol withdrawal delirium typically include hypertension, tachycardia, nausea and vomiting, tremors, especially in the hands, sweating, anxiety, agitation, tactile disturbance, hallucinations such as auditory or visual disturbances, headache and disorientation. 4. A patient with a diagnosis of anorexia nervosa, who is in state of starvation, is in a 2-bedroom. A newly admitted patient will be assigned to this patient's room. Which patient could be the best choice as a roommate for the patient with anorexia nervosa? A. A patient with pneumonia. B. A patient undergoing diagnostic test. C. A patient who thrives on managing others. D. A patient who could benefit from the patient's assistance at mealtime. Answer: B. Rationale: the patient undergoing diagnostic test is an acceptable roommate. The patient with anorexia nervosa is most likely experiencing hematological complications, such as leukopenia. Having a roommate with pneumonia would place the patient with anorexia nervosa at risk for infection. The patient with anorexia nervosa should not be put in a situation in which the patient can focus on nutritional needs of others or be managed by others, because this may contribute to sublimation and suppression of personal hunger. 5. The nurse is caring for a patient who was admitted to mental health unit recently for anorexia nervosa. The nurse enters the patient's room and notes that the patient is engaged in rigorous push-ups. Which nursing action is most appropriate? A. Allow the patient to complete the exercise program. B. Interrupt the patient and weigh the patient immediately. C. Tell the patient that exercising rigorously is not allowed. D. Interrupt the patient and offer to take the patient for a walk. Answer: D. Rationale: patient with anorexia nervosa frequently are preoccupied with rigorous exercise and push themselves beyond normal limits to work off calorie intake. The nurse must provide appropriate exercise and place limits on rigorous activities. The correct option stops the harmful behavior yet provides the patient with an activity to decrease anxiety that is not harmful. Weighing the patient immediately reinforces the patient's preoccupation with weight. Allowing the patient to complete the exercise program can be harmful to the patient. Telling the patient that completing the exercise is not allowed and will increase the patient anxiety.
6. The nurse is preparing to perform an admission assessment on a patient with a diagnosis of bulimia nervosa. Which assessment findings would the nurse expect to note? Select all that apply. A. Dental decay. B. Moist, oily skin. C. Loss of tooth enamel. D. Electrolytes imbalances. E. Body weight well below ideal range. Answer: A, C and D. Rationale: patients with bulimia nervosa initially may not appear to be physically or emotionally ill. They are often at or slightly below ideal body weight. On further inspection, a patient exhibits dental decay and loss of tooth enamel if the patient has been including vomiting. Electrolytes imbalance are present. Dry, scaly skin, rather than moist, oily skin, is present.
7. A hospitalized patient with a history of alcohol use disorder tells the nurse, "I am leaving now, I must go. I don't want any more treatment. I have things to do right away." The patient has not been discharged and scheduled for an important diagnostic test to be performed in 1 hour. After the nurse discusses the patient's concerns with the patient dresses and begins to walk out of the room. What action would the nurse take? A. Call the supervisor. B. Call security to block all exit areas. C. Restrain the patient until the primary health care provider, PHCP, can be reached. D. Tell the patient that he cannot return to hospital again if the patient leaves now. Answer: A. Rationale: most healthcare facilities have documents that the patient is asked to sign relating to the patient's responsibilities when the patient leaves against medical advice. The patient would be asked to wait to speak to the PHCP before leaving and to sign against medical advice document before leaving. If the patient refuses to do so, the nurse cannot hold the patient against the patient's will. Therefore, in this situation, the nurse would call the nursing supervisor. The nurse can be charged with false imprisonment if patient are made to believe wrongfully that they cannot leave the hospital. Restraining the patient and calling security to block the exits constitute false imprisonment. All patients have a right to health care and cannot be told otherwise.
The nurse determines that the spouse of an alcoholic patient is benefiting an Al-Anon group if the nurse hears the spouse make which statement? A. I no longer feel that I deserve the beating my partner inflicts on me. B. My attendance at the meetings has helped me to see that I provoke my partner's violence. C. I enjoy attending the meetings because they get me out of the house and away my partner. D. I can only tolerate my partner's destructive behaviors now that I know they are common among alcoholics. Answer: A. Rationale: Al-Anon support groups are a protected, supportive opportunity for spouse and significant others to learn what to expect and to obtain excellent pointers about successful behavior changes. The correct option is the healthiest response because it amplifies an understanding that the alcoholic partner is responsible for their own behavior and cannot be allowed to blame family members for loss of control. Option 2 is incorrect because the non-alcoholic partner should not feel responsible when the spouse loses control. Option 3 indicates that the group is viewed as an escape, not a place to work on issues. Option 4 indicates that the non-alcoholic partner remains codependent.
9. Which interventions are most appropriate for caring for a patient in alcohol withdrawal? Select all that apply. A. Monitor vital signs. B. Provide a safe environment. C. Address hallucinations therapeutically. D. Provide stimulation in the environment. E. Provide reality orientation as appropriate. F. Maintain NPO, nothing by mouth, status. Answer: A, B, C, E. Rationale: when the patient is experiencing withdrawal from alcohol, the priority for care is to prevent the patient harming self or others. The nurse would monitor the vital signs closely to report abnormal findings. The nurse would provide low stimulation environment to maintain the patient in as calm state as possible. The nurse would reorient the patient to reality frequently and would address hallucinations therapeutically. Adequate nutritional and fluid intake needs to be maintained.
10. The home health nurse visits a patient at home and determines that the patient is dependent on drugs. During the assessment, which action would the nurse take to plan appropriate nursing care? A. Ask the patient why they started taking illegal drugs. B. Ask the patient about the amount of drug use and its effect. C. Ask the patient how long they thought that they could take drugs without someone finding out. D. Not ask any questions for fear that the patient is in denial and will throw the nurse out of the home. Answer. B. Rationale. Whenever the nurse carries out an assessment for a patient who is dependent on drugs, it is best for the nurse to attempt to elicit information by being non-judgmental and direct. Option A is incorrect because it is judgmental and off-focus and reflects the nurse's bias. Option C is incorrect and judgmental, insensitive, and aggressive, which is non-therapeutic. Option D is incorrect because it indicates positivity on the nurse's part and uses rationalization to avoid the therapeutic nursing intervention. Thanks for watching.